I'm delighted to welcome you all today. This is the launch of our year-long Parkinson's and Mental Health initiative that's funded by a grant by the Parkinson's Foundation. And we're so excited to present this first in the nation program for Parkinson's and yoga therapy mental health. So welcome. At this time, I'd like to introduce you to Dr. Ghada Osman. She's our keynote speaker today, and she'll be speaking about emotional matters and Parkinson's, not only for the Parkinson patient, but also for the caregiver care partner. During her presentation, you'll note in the chat a link that we ask you to click on sometime before you leave and sign in so that we will have be able to document and let the Parkinson's Foundation know who was here and who participated. So thank you. So without further ado, I turn the mic and the video camera over to Dr. Osman.
All right, thank you so much, Melinda. It's such a pleasure to be here with everybody today, whether folks that I know from before or folks who are new to me. So thank you so much for joining me this afternoon for me, sort of evening for you all by the end of the time. All right. So I will go ahead and share some information. This will be kind of a mixed experience with some information and then some experiential. Knowing that we're a relatively mixed audience, and so coming into this knowing that some areas may resonate with you more and feel more significant, and other areas maybe not so much. And so just approaching this, in whatever way fits for you and what you're here hopefully to gain. So to tell you a little bit about myself before we talk about the material in general. So for those who don't know me, my name is Ghada Osman. I am actually in San Diego, California, and I am a psychotherapist. I am also a yoga therapist and have been a yoga therapist and yoga teacher, at least I did my YTT 21 years ago at the Kripalu Center. It's hard to imagine that it's now that long ago. And so as a result, I've incorporated, because I've been a yoga teacher for so long, I've incorporated yoga in my practice with mental health for a long time. And so now incorporating yoga and mental health and working with mental health via yoga is something that we hear about a lot more than we did back in the day when I started doing this. And then I also have a book on the subject, and I really enjoy working with folks with different concerns coming into yoga therapy, and including working with folks with Parkinson's and the mental health aspect of Parkinson's. So I'm going to share with you a presentation, knowing that we'll kind of come in and out of this, just to make sure first, since I did have all that internet connection issue. Can you all hear me okay? Okay, great. All right. So hopefully things will hold for the next almost 3 hours. All right. So. All right. So let's talk a little bit about why the focus on emotional health. And actually, Fulvia, when you were introducing yourself, you mentioned this very clearly, right? That you actually described this as the biggest barrier in some ways. And so, yeah, why do we focus on emotional health when we talk about Parkinson's? Why is that important? What are some thoughts that people have about that, about why, rather than saying, oh, we're focusing on motor symptoms, and by the way, there's emotional health, why would we focus so much on emotional health? What do you think?
Can I speak?
Please, yeah.
I don't want to talk over anyone. Well, I think specifically with neurodegenerative disorders, there's a lot of focus on mitigating symptoms because it's approached through a Western medical lens, where if they can alleviate the symptoms, then the emotional suffering won't be a factor, versus dealing with the emotional component for the patient and the family members and caregivers throughout the process, which is more integrative. So I think that's a problem with the health system in general, but with neurodegenerative specifically, um, there's so much with the brain going on already. So there's the symptoms, how it affects their life, and then the actual brain incorporation with how it might actually be affecting the way their emotions feel to them.
Yeah.
So there's a lot of different components that I think get brushed over and aren't societally accepted to just come out and talk about.
Yeah. So first of all, yeah, there are a few points that you mentioned in there that directly connect, right? So one of them is our tendency to treat the body as separate from the mind. And then we talk about the mind-body connection as if still it's a connection between two different things. And those of you that have studied with me for mental health have heard me say this before, right? That there's no such thing as a mind-body connection. They're all one thing. And so we tend to treat what we see, and we tend to work with motor symptoms a lot because we have a sense of that. We can see that based on somebody's range of motion, just their movements in general, etc. But then as a result, we shortchange areas that we don't see so clearly. And emotional health is an important, like very significant element. And yeah, without emotional health feeling more grounded and more stable, everything else is then shaken up. So, in some ways, of course, it's my bias as a psychotherapist to believe that emotional health is really the starting point and the key. And at the same time, when we think back over periods of our lives, what the way that we tend to think of periods of our lives is based on how we felt. So I may look at a period of my life and say, oh, I was feeling these physical challenges, but actually what stands out to me much more is how I felt emotionally, right? So emotional health is key. And then emotional health is especially key when we're working with particular conditions that are very connected to areas in the brain that also work directly with emotional health. And we'll talk about that more. Anything else that anybody wants to add here?
I I personally think that it's kind of like being trapped in your own body, and your body is failing you and not doing the things that it like that it can do and that it should do. And I think that mental health is so important because there's a lot of probably depression and anxiety and even some fearfulness that go into trying to figure out this body, as it kind of, like I said, it starts to like betray you. You're like, I can't walk the way I used to. I can't, even with the tremors, I can't control the shaking. And so again, I think that the mental health portion of it is almost just as big as the physical.
Yeah, thank you. Yeah. A lot of the suffering that we experience is due to how the mind interprets what's happening, including what's happening in the body. Absolutely. And so shifting away from that, or really broadening the perspective, is about then allowing the mind to note more. It's almost like we're working the mind out more. So focusing on emotional health gives us a way of working the body in a way that's far more holistic than just focusing on very specific symptoms that are easier to discern and measure from the outside. All right. So when we're talking about Parkinson's in general, as was mentioned in different ways earlier, there's actually a very clear connection also with mental health. So you'll notice, by the way, that I tend to switch between talking about mental health and emotional health. Mental health, I feel, unfortunately, has the term has had a certain amount of stigma attached to it. But then the other, and that makes me, that doesn't encourage me to use it. But the other reason that I feel also that emotional health is just more descriptive is that it's more holistic. Mental health as a term, again, refers to the mind, as if the mind is separate from the rest of the body. Whereas emotional health is more holistic, it's more our entire being and how that then impacts us. Nonetheless, when I'm talking especially about previous research that's been done, then I'm using the term that was used in the research. So in this case, studies have shown that actually shifts in mental and emotional health in a lot of people that are later diagnosed with PD begin before the patient shows motor symptoms, before motor symptoms become apparent, and well before there's a clinical diagnosis of PD. So they're actually among the earliest symptoms, but we don't tend to view them as symptoms of PD. And so as a result, it's often motor symptoms that then lead to a diagnosis. So research into appropriate mental health care in patients with PD has been pretty limited. So we're gonna watch a very brief video about depression and anxiety for folks with Parkinson's. And I'm just gonna ask you as we're watching it to just note the main points in the video. So just whatever stands out to you, and then we'll talk more about it.
Listen and see what the main points are.
Are you seeing the video or still the PowerPoint?
It's just the PowerPoint.
Okay, I was gonna say, because I'm seeing a nod and a yes, and I was like, I shouldn't have asked the question like that. So let me switch over this share.
Disorder specialist and vice president of
And volume is good? All right.
medical communications at the Michael J. Fox Foundation for Parkinson's Research. Today I'll be talking about depression and anxiety in Parkinson's disease. Depression and anxiety are common non-motor symptoms associated with Parkinson's disease. They can occur at any time in the course of disease, even before the diagnosis is made. They can also occur independently of one another, but commonly they go hand in hand. Symptoms of depression include decreased mood or energy, lack of interest in previously enjoyable activities, difficulty concentrating, slowed thinking, or even changes in weight, appetite, or sleep. A lot of the symptoms of depression can overlap with the symptoms of Parkinson's, which can make it difficult to determine what's what. Anxiety causes a lot of the same symptoms as depression, but can also lead to uncontrollable worry or feelings of restlessness. The levels of depression and anxiety in Parkinson's typically stay fairly constant, but anxiety in particular can fluctuate. Some people will have more significant or severe episodes of anxiety, and sometimes this can even happen in conjunction with medication like levodopa wearing off toward the end of a dose. If this is the case, symptoms will be somewhat alleviated with the next dosage of medication. Depression and anxiety can be treated with medications, counseling, or a combination of both. It's important to treat mood symptoms because they can decrease quality of life and make it more difficult to manage motor and non-motor symptoms in Parkinson's. The medications that are used to treat depression and anxiety in Parkinson's are the same as those used to treat depression and anxiety in people who don't have Parkinson's. They work to regulate mood chemicals like serotonin, norepinephrine, or dopamine. The most commonly prescribed medications for depression and anxiety in Parkinson's are what is known as SSRIs, or selective serotonin reuptake inhibitors. Examples of these would be Paxil, which is known as paroxetine, or Prozac, which is otherwise called fluoxetine. Whichever medication is chosen is started at a low dose and then worked up gradually and continued for several weeks to see if it gives benefit. If it doesn't work, another SSRI might be chosen, or doctors might prescribe from a completely different class of antidepressants. Antidepressants also work to treat anxiety, but if a person has more significant episodes of anxiety or panic, they may be prescribed an as-needed medication to take. This class of drugs is known as benzodiazepine.
All right. Okay. So yeah, what are some of the main points that came up in that? And I'm partly showing this as an example of kind of how mental health is talked about often when it comes to focusing on PD diagnoses. Yeah, what are some of the main points?
It seems to focus purely on medical solutions.
Right? Yeah. So yeah, such a narrow focus on medications, which yes, can be helpful, but not a lot of exploration of other possibilities. Yeah. What else? Yeah, Tiffany.
Just thinking about the effects of how those prescriptions are usually prescribed by mental health professionals, but might be used in different ways for this type of condition, but the use of this medication might not be overseen in the same way as if it would be used on a patient for a mental health use, I see can be very problematic over time, because the side effects and the effects on that person's quality of life might not be handled in a way that the drug, like how it might be for the drug being used in a different way, especially with the changing of neurotransmitters that can change someone's entire perception of reality, how they feel every single day, how everything is perceived through their reality. So I think that can be, if it's just treated very clinically and quantitative instead of qualitatively, that can leave a person feeling really lost on top of their experience of their symptoms. So I see that, as a problem.
It's like treating symptoms as if they exist in sort of silos. That I'm experiencing this, and so here's some medication. I'm experiencing this, and here's some medication. Rather, again, than looking at it holistically and looking at other options that are not solely medication related. There is something that affects especially folks with Parkinson's that we'll talk about a little bit later, that's called a motion-emotion conundrum. And the emotion-emotion conundrum is basically treating with symptoms that are more motor symptoms or treating symptoms that are more emotional health symptoms, and the fact that the medications of one can actually impact then what happens with the other, and what are other ways of working with that. Yeah, thank you. Other main points that you see here?
I just wanted to say, I don't know so much about those medications, especially antidepressants, but I know there's a lot of side effects to them too. And some of them are even, I don't know, correct me if I'm wrong, suicidal kind of tendencies and things like that. Some that may even cause more damage to the person than actually help them. I'm not sure though, but like that's every time I hear something about medication in a commercial, you always have this list of like side effects, and depending on the person's emotional health, I guess they can be more stronger on them, especially with Parkinson's.
Absolutely. That it's a focus on particular symptoms, but then what about the bigger picture and the impact that it could potentially have? Definitely, yeah. And side effects, which are of course something that happens with every medication, but yeah, side effects of mental health medications are mental health side effects usually. I mean, there may be some other side effects too, but there's a lot that is then related to mental health. And so then we find ourselves potentially addressing a symptom, and then there's a side effect, and then needing to address that side effect, et cetera. And so looking at medication as the only solution to mental health by no means then is the way to go. And in general, in studies on Parkinson's that have taken into account the significance of mental health, the discussion that's still there is about mental health, is still about medications, with a little bit of a discussion about the role of therapy potentially, but still very little discussion about other areas. And so we really here are, as Melinda described at the beginning, venturing into new territory that's exciting. Hi, Josie.
Hi, sorry, I thought it was 5:30. That's my mistake. Great to meet you.
Good to meet you too. All right, so let's talk a little bit about non-motor symptoms in Parkinson's. So like we were saying, many think of PD as a movement disorder with symptoms that we can see more clearly when, from the outside. So symptoms that are not only internally experienced by the person who has PD. So tremors, muscular rigidity, slow movements, effects in fine motor skills, those are symptoms that we tend to think of when we think of PD. But actually, there is also a range of symptoms that are non-motor symptoms that are important for us to keep in mind. And one of the good pieces of news that we'll talk about later today is how we may be talking about a grouping of symptoms that look like they're very different symptoms, but when it comes both time to understand why this is, why they exist, as well as how to work with them using yoga, we can do many of the same things that would help address some of these experiences. So emotional shifts, depression, anxiety, impulse control, which isn't so much a result of Parkinson's, but is often a result of medications for Parkinson's. Sleep difficulties, that's a big one, and an altered sleep schedule in general. Cognitive shifts, and then shifts that happen for different systems. So GI, cardiovascular, urinary, sexual, thermoregulation, so temperature, and then pain. Right? So these may be symptoms that folks with Parkinson's experience beyond what we tend to look at that we can see more from the outside. So let's talk a little bit about what Parkinson's is, and I know this is material maybe more familiar to some of you than to others. So Parkinson's is a progressive disease, right? So as I'm feeling better and as my diagnosis is newer, then it's a good time wherever I come into the process of doing yoga, etc., that I'm now starting from a place where I can maintain what I have and strengthen that, right? So it's progressive of the nervous system. And then there are two things that are going on biologically that impact the person with Parkinson's, and both of these, and especially one of them, is very connected with mental health, with emotional health. One of them has to do with the basal ganglia of the brain. So if I look at my picture here of the brain, we're talking about this portion here. This gets weaker. And as this gets weaker over here, this also impacts the neurotransmitter dopamine. So dopamine as a neurotransmitter is very connected with mood. And this is why there is a very core connection between a diagnosis of PD and emotional health impact. That's not just about noticing how one's life may have changed and how that impacts me emotionally, but there's a very direct connection in mood resulting from dopamine not being created at the same levels. So dopamine is a neurotransmitter that's a chemical messenger. And one of the things that it does is that it helps produce smoother, more purposeful movement, also impacts motivation. So if you notice whether you have a personal experience with Parkinson's or have witnessed somebody with Parkinson's who may have talked about a lack of motivation, that's why. That the dopamine and the impact of the production of dopamine is directly related to that. Dopamine is also related to memory and related to focus. And as we mentioned, it's produced in this part of the brain that is impacted by PD. I'm going to talk briefly about the brainstem, and you have some of this information in the PowerPoint that's in the Schoology module. So I don't want to spend a lot of time going into the particulars. If you have more questions about the particulars, then always feel free to reach out to me. So anytime when we're talking about the brain, in general, the deeper we are in the brain, the more we're talking about more basic functions. So when we're talking about the brainstem, we're talking about bodily functions. And so that's why if the brainstem is impacted, then many things in the body can be impacted. And that includes, again, emotional health. But in addition to that, GI, temperature control, sleep, etc., are connected to the brainstem and that impact. And then talking a little bit more here. So this is the area that we talked about a little bit before that's related to that production of dopamine. And so then this also has its impact on emotional health as well as potentially on other areas. And then the other part that's important to keep in mind, and that's why a lot of programs for folks with PD focus on things that have to do with tasks. So if, for example, any of you are familiar with programs that, let's say, have to do with, I had one person I worked with, for example, who went to weekly boxing sessions. And part of the boxing, there's the physical movement, but also part of the training was to focus on a particular area. So the cognitive piece, the executive functioning, that keeping that training in addition to other muscles. And so when we're working with yoga, for example, also keeping that in mind, that we have a drishti, we have a point that we're focused on that actually helps with executive functioning, being very mindful of following, having a series that goes here and then here and then here, clearly outlined, then helps with that training of executive functioning. The symptoms of the cortex here, I'm going to go back to when I talk about medication down the road. So I'll talk a little bit more and then pause for questions on the neurology aspect of things. So folks with PD and depression, we talked about how this is an impact, as a result of dopamine and shifts in dopamine. And then the other part of this is that there is what we refer to as psychosocial stressors, right? Day to day, there are things that I have to do that cause stress for whatever reason. So they're difficult to carry out. They are not the same way they used to be for me before. I have to really prepare to be able to do them, all of that. So then those are additional stressors that then impact people's emotional health. I talk a little bit about how in typical terminology, the stages that are described for PD. So the first stage that's described, stage one, usually the person is experiencing something on one side of the body. So might have to do with the swing of an arm, might have to do with a sensation, might have to do with a postural change, but what we refer to as stage one. Stage two usually impacts both sides of the body. So it's the beginning of having the second side also be impacted. So if someone is experiencing impact on both sides, then we're now at stage two. And then stage three has more to do with imbalance. And so thinking about this in terms of where someone is and therefore what's the most helpful work to be done in terms of training, then stage three, if someone is experiencing imbalance, then working particularly with balance is very helpful. Stage four, so this is someone for whom more assistance may be needed. And so then we're working with on slightly different tasks and then moving to stage five. In addition to kind of our typical demographics when it comes to onset of PD, there's also folks who we describe as early onset. So basically these are folks who have been diagnosed with PD before the age of 50. And around 10 to 20% of those with Parkinson's are diagnosed at an earlier age. So that's around 6,000 to 12,000 folks under 50 with a Parkinson's diagnosis in the US. And one of the things that happens anytime we're talking about a chronic illness is that if I am experiencing a chronic illness, it's pretty typical to compare myself to other people that I consider my peers in some shape or form. And so for someone who's younger during a time of a diagnosis, then obviously that person then is comparing themselves to people around them, and this can really affect identity, which is a major other emotional piece, which is relevant obviously at all times, but highlighting it here when we're talking about early onset. All right, so I'll talk a little bit about anxiety and then a little bit about depression and then pause to take some questions. So the two areas that we heard about the most with the video, symptoms of anxiety and symptoms of depression. So this is a really huge range that studies with structured interviews report a prevalence of anxiety in patients with PD that ranges from around 20% to around 67%. So in other words, that this means, right, that between a fifth and 2/3 of people that have been diagnosed with Parkinson's experience something that could be described as anxiety. And then studies that rely on questionnaires report even higher prevalence, and that's not unusual, right? So if I have to take a questionnaire, I don't have someone right in front of me who's asking me questions. Sure, in some ways that can be more challenging, but in other ways, sometimes that can allow people to open up more. So that's a particularly typical response when it comes to research of the sort. Three most common anxiety disorders in folks with PD: panic, Generalized anxiety, so that's if you're feeling anxious all the time, basically, that's generalized anxiety disorder. And then social phobia, so fear of going out, a fear of interacting with other people, that can be very much connected to the change in motor symptoms, etc., but also can be something that is directly connected to just those dopamine level shifts. So these are the three areas. All right. Yeah, Tiff.
I have two questions. So, first one, I mean, it's sounding like it would go along with CBT, but is there a specific psychotherapy that has been effective for Parkinson's patients,
Yeah, and actually,
specifically?
I will talk about that, and I'll talk about two studies in particular. Yeah.
Wonderful. Okay, and the other question, this is kind of specific, so I might leave it for the end if there's explanation, but I was recently reading Body Keeps the Score by Bessel van der Kolk, and I remember reading about the serotonin uptake inhibitors not being effective for the veteran population. So I was wondering if within the PD population, if that's used to treat it, is there like a pocket within veterans that, is there some sort of difficulty with treating, or is that something that's not really, I don't know.
So
Just made
I'll
me think about
answer
that.
that. Yeah, I'll answer that relatively briefly, and then I'm happy to talk more. And yeah, it's not something that I'll go into a lot, but actually,
Okay.
SSRIs in general have not been shown to be the best option for folks with PD. That they're
Okay.
not the best medication option, and other classes of antidepressant drugs have been ones that have been seen to have greater success rates.
With the dopamine?
Yeah, exactly. Because SSRIs work on serotonin, and the issue is not about serotonin. So
Okay.
even though they're the most commonly prescribed in general.
Wow. Okay. Thank you.
Yeah, sure. Any other questions here since we paused here? All right. So let's talk a little bit about what makes something anxiety. So we talk about eustress, and eustress is basically the stress that I might experience when something's about to happen and I'm kind of excited about it. So I might feel that, but it might actually motivate me to do things. So that's what we think of as like good stress. Distress is what we think of as stress where something's about to happen and I don't feel good about it. I feel stressed out. That's different from anxiety. Anxiety, very specifically, is about something getting in the way of my day-to-day functioning. So that's the difference between stress and anxiety. So we tend to group them together. Actually, anxiety is something that I feel really impacts me day to day, and then may in fact impact me day to day. But if I feel it, that's enough. It doesn't matter that somebody might say, oh, but you're functioning great and you look so great. And it's like, if I feel that every day I experience this anxiety and it impacts me, then we would call this anxiety. So that's what we're referring to when we're talking about levels of anxiety. And when we say that between 20% and 2/3, between a fifth and 2/3 of folks with a PD diagnosis reported experiencing anxiety, that they reported experiencing something that's at the level where they feel it impacts their day-to-day lives. Okay. So there's not really much correlation between levels of anxiety and other symptoms. So there may be a little bit of a correlation in terms of where, if someone has lesions, where they are, but not a lot of correlation. But anxiety, of course, can really have an impact on motor symptoms. And so that's why it's very helpful for us to work with anxiety. So if we're talking about anxiety and in general signs and symptoms of anxiety, what are some of the signs and symptoms that we may be talking about? Because a lot of the time too, when it comes to emotional health, people don't necessarily come into a class or come to talk to someone they know and focus on the emotional health. And so sometimes we have to kind of listen more closely to know what's going on. So what would you say are some of the signs and symptoms of anxiety if we think first about just what's emotional? What are some of the things that you might see?
Distressed, fidgety,
Mhm.
inability to like focus in on what we might be doing.
Yeah.
Agitated.
So upset, something that we would think of as in the family of sadness somewhere. Yeah, fidgety, antsy, right? So hard to focus. So if you are the person who is leading an experience, a class, etc., you may notice that in the folks that you're working with. And if you're the participant, then maybe, yeah, feeling like it's hard to focus, and that can be a direct result of the PD diagnosis. Yeah, and that's therefore an additional area where it's helpful to have directed focus. What else? Other emotional signs and symptoms.
Frustration.
Frustration, yeah. What else? So sometimes when our emotions are amplified, they show more, but other times what happens when our emotions are amplified?
People shut down.
Shut down, yeah. So disengagement, what looks like tuning out, that also can be a symptom of anxiety, right? So it seems like the person's checked out, but actually this is a result of anxiety that like the system shuts down, right? Which is something that happens to any of us, but then noting it in this particular context. And then, yeah, behavioral then is, part and parcel with that, right? So connected to some of these things. How about physical? So physical signs and symptoms of anxiety.
Rapid eye movement, like
Rapid eye movement, yeah. So looking around a lot. What else?
Their breathing can change also.
Faster breathing, yeah.
Their tremors are more pronounced.
Yeah, so other symptoms may be more pronounced. Yeah. What else?
You might see them perspire.
Perspiring, yeah.
Flushing or like having a closed off posture.
Flushing, closed off, yeah.
increase in heart rate.
Increase in heart rate, yeah. So we're mentioning all this as kind of a reminder, right? That sometimes when we see these aspects, or if we're experiencing them, we think of them as only physical. Oh, it must be that I'm working too hard physically, or it must be that this is too much physically, but remembering that these are also signs of anxiety that the person may or may not be aware of, right? So sometimes we feel anxious and we're aware we feel anxious, but sometimes the physical symptoms are there without necessarily that inner feeling of anxiety. So yeah, some of our areas here then have to do, crying, nervousness, boredom, edginess, antsiness, feeling powerless, overwhelmed, loneliness, depression, constant worry, etc. And then feeling like you're not yourself anymore, loss of sense of humor, for example. And then behavior, restlessness, judgments, and then certain things, grinding teeth at night, which is very connected to anxiety. Feeling like one's not able to get things done and feeling frustrated, anger, lack of creativity, etc. And then the physical, so like headaches, indigestion, stomach aches, sweaty palms, high blood pressure, dizziness, kind of feeling out of it, tension in the body, heart rate, pulse irregularities, etc., etc. Some of the things that we mentioned, again, can be signs and symptoms of anxiety, and so being mindful of that. All right, let's talk a little bit about depression before we pause to take some questions here. So depression, again, is reported to be common in patients with PD, and more so the risk of depression the risk of PD in patients with depressive disorders is actually more than what's in the general population. So I'll go back to that in a second, because what I'm about to say next is actually a little bit different from the other end of things. So about 40% of persons with PD meet criteria for depression, but actually depression in general in our society is underreported, right? And so a lot of people don't report depression symptoms because there's stigma around it, and so the chances are that it's a higher percentage. And emotional health is related to physical symptoms. So when we work with emotional health, that helps then slow down progression in physical symptoms. So Focusing on this second point in particular, that compared with the motor shifts in PD, depression is actually what's found to be more predictive of overall physical shifts and emotional shifts. But the challenge with depression, which was touched on in that video that we saw, is that a lot of the time the symptoms are missed because they can be symptoms that sound like symptoms of PD. So if I'm talking about lethargy, that I feel like blah and it's hard for me to motivate, that's a symptom that can be related to both depression and to PD, for example. So these are two studies that I wanted to share with you to demonstrate the connection between depression and PD, where because somebody has depression, they're at higher risk of developing PD rather than the other way around only. So in this large sample retrospective study, so retrospective means that we have the people that we're working on, but then we look back at their history. So, the people that we're working with in this case are 4,634 patients with depression, and then 18,544 control patients. And the patients with depression were 3.24 times more likely to develop PD compared with the control patient. So really the study is actually starting at the end. So it's taking a group of people that have PD and looking back on their records to see if they've ever been treated for depression. And it turns out that in the past, these folks were actually treated for depression, so were given medication, therapy, etc., 3 times more likely than people who did not develop PD. Another study, so 105,416 subjects who report a lifetime prevalence of depression prior to onset of PD. So 9.2 compared to 4% in the control population. So again, these are folks who have had a history of depression and then have onset of PD, and basically were double the number of them who had experienced depression. Okay. Signs of depression, so many of the things that we think of as related to depression, right? A depressed mood, feeling kind of blah. Depression affects sleep, can affect eating, loss of energy, poor concentration, low self-esteem, etc. Depression can also show up as agitation, and so it's something to keep in mind. That agitation, sure, is connected to anxiety, but can also be connected to depression. And one major term for this, anhedonia, which is the inability to feel pleasure. So even though it's understood as a symptom of depression, it may be characteristic of PD itself. And so then one of the things that we're working on when we're working with folks with PD is then focusing on helping with that kind of blah feeling that can be there and how we do that. So treatment, this actually connects right back, Tiffany, to the question that you asked about SSRIs not as effective in the treatment of PD, and that SNRIs have been especially shown to be more relevant. I'm mentioning this especially for people who will be working with folks with PD who may have been prescribed something, just to have like a little bit more of a sense of that. I'll pause here actually to see if there are any questions. And you can just go ahead and unmute if you have a question, since I don't see everybody on the same screen. Yeah, Grizel.
So going back to bringing pleasure, so things that are fun in the class, like laughter, making sounds, and just kind of being silly type of asanas. Is that what you're kind of referring to? Like if
Absolutely. And and that's one of the things that really happens when we get sick too, right? Is it's like going to this class and that class and the other class, and it can be very serious. And it's like, what about the fun part? What about connecting over not necessarily mindfulness is wonderful and focus is wonderful and all these things are great, but What about connection also through joy? Yeah. Other questions here? Yeah, Martha. And yeah, folks can unmute since I don't see everybody on the same
So,
screen.
The thing about not feeling like or not showing emotions, but my question is, are they feeling something inside that they cannot express physically, or how do we deal with that? Because
Yeah, so
try to
you
excite
know,
them too much, and we're not going to see any reaction. But
yeah,
are something?
but this is, yeah, so this is where we check in, right? And there are a number of things happening here. So in general, some of us show more emotion than others anyway, right? And then, yeah, over time, how emotion comes across and how someone who may not be as used to reading what's going on with someone interprets it, then yeah, is also relevant. And so the checking in with people and that one word that describes how you feel, and having much more of that, the knowledge of, yeah, what's going on right now. It doesn't have to be long, right? And we don't really want it to be long because then it's distracting, but again, getting to the core of that. Yeah. Other questions here? All right. So let's talk a little bit about impact, which is, not too surprising, right? People talk about stages of response to difficult news, right? That sometimes can be referred to as stages of grief, although I think that's a little bit of a misleading term. Both talking about them as stages and then specifically referring to this as grief. I like to think of it as sort of visiting points, stopping points. So when you receive a diagnosis, right, what you might experience is shock. And then there may be a little bit of denial. And denial can be, this isn't really going on, but denial can sometimes also just be, I'm good, I'm going to keep doing my life. I don't need to change anything. And in our society where people love positivity, we're kind of addicted to positivity. Oh, this person's so positive. They won't let this get them down. But actually, sometimes what we think of as positivity is actually denial, right? So if I have a new diagnosis and I notice what's happening with me and I, make shifts in my life and figure out what fits for me, that's very different from if I have a diagnosis and no matter what, I'm going to keep going. And people say, yeah, you go, you're going to get this, etc. But actually, I'm not in the here and now. And so it's something for us to be mindful of, whether in ourselves or working with folks, that positivity is lovely if it fits for someone. But what is the positivity about? Is it about this moment that I'm in right now? Or is it actually denial of what's happening for me? So tuning into that, and that's something that I hear in the yoga world a lot. Oh, this person is so wonderful, and they're positive, and it's putting it out there to the universe, and that's great. But yeah, is the person, are we in sync with our circumstances, and then saying, yeah, you know what, my circumstances have changed, and I'm here, and I'm adjusting, and I'm taking it on. That's one thing. Versus like, I'm going to keep going with whatever I did before, right? Which then is a form of denial. Anger, right? Bargaining. So sometimes bargaining also in long-term illness looks like, if I just do these things, then I'll be right back where I was at the start. And again, for those of us in the yoga world, sometimes we can have a little bit of magical thinking around that, right? That we think yoga is wonderful. And it is. And yoga helps people maintain where they are and helps with regaining. And at the same time, anytime I have something that's a long-term illness, it's also, again, about meeting it where I am right now and coming to peace with that and what that means and the challenge of that particular journey. Depression, testing things out, seeing how things go, and then in an ideal world, we arrive at a place of acceptance, but the fact of the matter is in life, we move around these stages all the time. And that's why I don't like to refer to them as stages, right? So these stopping points, visiting points, we visit and go back and forth. And so again, knowing that for yourself or knowing that for people that you work with. So here's your question about psychotherapy, Tiffany. So it's actually relatively new work. So I am literally sharing with you two studies. The two that I selected to share with you are from last year and this year. So it's actually relatively new, looking at the impact of psychotherapy for PD, which is kind of remarkable, right? That this is cutting edge research. I mean, it's not anything that would be such a radical concept, that if people are experiencing depression, then maybe psychotherapy would help. But the reason that it's relevant is because we are talking about depression that's a result of impact on dopamine because of a change in the brain. So what this tells us, which then is even more relevant when we're talking about yoga, this tells us that even though something has shifted in the brain in terms of actual neurotransmitter production levels, psychotherapy can still be helpful to someone with PD. And that's huge. And it's especially huge because psychotherapy, we're talking about talking. And talk therapy is very different from therapy that's in the body. And so if we see success with talk therapy, then that's even more, when it comes to mental health for PD, that's even more relevant when we're talking about yoga. So in this particular study from last year, and by the way, there is way more studies about PD and mental health coming from areas outside the US than within the US. Two big areas, Taiwan is one and the Netherlands is another. So this study is actually out of Taiwan. So it's a meta-analysis of 7 studies with 191 patients. And it showed the benefits of cognitive behavioral therapy, which is really the most common talk therapy modality out there, and the reduction of anxiety and depression for individuals with PD. And then therefore having more studies would be helpful. So that's promising, as is a second study that I wanted to share with you from this year. It's actually from February, out of the Netherlands. This had a long lead up, and the argument is basically that, again, therapy, cognitive behavioral therapy, can help with anxiety experienced by folks with PD. So going to the method of this, it had 48 people with PD, and they either had therapy, cognitive behavioral therapy, or basically were just monitored. And specifically, after looking at what was going on after 3 months, after 6 months, and it was measured, so using 2 scales, both groups showed clinically relevant improvement, but the anxiety levels in folks who had therapy were considerably more, so the reduction in anxiety levels, so the anxiety levels were lower in the folks that had therapy compared to the group who was just being monitored. And this was maintained. So again, this is an example of how cognitive behavioral therapy is effective in treating anxiety in patients with PD for situational and social anxiety, as well as avoidance behavior. So good sign when it comes to something where we're talking about level changes in neurotransmitter levels. And like I said, particularly promising when we come to talk about yoga. So if the effects of Parkinson's are not only cognitive, then why turn only to a cognitive therapy model, right? If we know that the impact of actually pretty much anything that we experience is not only on the mind, is not only on this part of the body, then why not go with something more holistic that impacts the entire system, such as, for example, yoga? Another study that I'll share with you quickly here before then moving on to kind of applications. So this is one from 2 years ago, 2019. So this is one of the few studies on yoga and emotional health for PD. So some people basically did stretching and resistance training, and then some people did mindfulness yoga. And the result was that mindfulness yoga, not surprisingly, especially helped with emotional symptoms. You have a little bit here about the Michael J. Fox Foundation, which I think is helpful to know about in terms of what their activities have been. So the video that we saw was related to them. And again, noticing that a lot of their work about working with depression and anxiety has been the funding. A lot of it has been on antidepressants, but then is now branching out to include other areas as well. All right. Any questions here?
I have one in terms
Yeah.
of progress tracking, and well, let me reframe that. So with CBT, do they do any type of like charting, journaling, tracking throughout that type of process? So I was wondering with the neurodegenerative disorder, like how it is with like the HPA cortisol axis of the brain, is tracking helpful in helping them feel a sense of control over their experience, or could that be triggering to someone with a degenerative disorder?
So it depends what you track, right? So one of the things with tracking in general in any kind of psychotherapy context is you want to be tracking something about where when you track it, it helps to track it because there's something that you can do about it, right? So one of the things in general in any sort of therapeutic program, psychotherapy that is, that we hope the therapist would introduce is what are some things that we have more control over and what are some things that we have less control over. And so anytime you give an assignment where someone is tracking, we want that to be in the area where someone has more control over it. Otherwise, yeah, it's frustrating to track, right? And that can be for any of us. I mean, I can track from now till the cows come home, I don't know, something that is very difficult for me to do. And I'm just going to get frustrated because it's not something that I can do easily, right? So yeah, it's tracking on something that then is more accessible.
So, in terms of intakes, assessments, and how you frame the progression of protocols, I was just wondering if you're going to go over that. Like, how do we help them feel like they're accomplishing something versus tracking how they might, something that might trigger them throughout the process? I don't know. Are you going to cover that?
Yeah, and we'll talk about this also as relates to emotional health, which is very different, right? So, tracking my emotional health is about kind of noting moments, and I do something and then notice how it impacts me emotionally. And that's very different from tracking that has to do with I have tasks that I want to accomplish and I'm tracking whether I'm going to accomplish them or not, right? So tracking from like thinking about it that way within a yoga framework is very different because it's very present moment focused. Does that make sense?
Yeah. So, like, if we're working on a progression of a krama to a full posture, I'm just wondering whether that can be empowering versus something that could be more frustrating.
So it depends on what it is that we're hoping for in the progression. So one of the things with working with emotional health is that I'm making the assumption that the progression is going to help someone feel better, not because they've arrived at a particular shape.
Okay.
Because that's right, that's a different measurement. That's actually ego, right? And certainly we all have ego and it can feel good to connect with ego, but actually happiness and joy, etc., is not connected to ego, it's connected to present moment. Right? That's that difference between sort of looking for things that create a quick fix where my ego is super excited about them versus contentment, santosha, etc. Any other questions here? All right. So then let's talk a little bit about what we're kind of up to here. So there is a difference that I think is very important for us to think about when we think about emotional health that has to do with foregrounding emotional health impact. So one of the things that I think happens when we're working with a chronic illness where we can see something such as, for example, movement, range of motion, etc., is that we tend to prioritize those experiences and tend to just look at emotional health as, well, I just have to make sure that I'm not upsetting someone too much. And I'm going to encourage us today to think about emotional health as the primary. Because again, if we think about periods of our lives, I might remember what was going on for me physically, but what impacts me much more is what's going on emotionally. what impacts how people engage with a long-term illness is their emotional health, not their physical health. And emotional health determines, in PD, research shows, determines progression of other symptoms. And so as we approach this, thinking about, okay, sure, I could keep things in mind, but how do I make this primary, with the understanding that when I'm making emotional health primary, I'm also helping with an array of so many other symptoms. All right. So, yoga, we have pranayama, we have mudras, we have asana. One of our big elements when it comes to yoga is that it's very easy for us to think of yoga as asana. Or sometimes we think of yoga as meditation, right? And ultimately, when we're talking about a yoga practice, among the most helpful practices are pranayama and mudras. And thinking about what is it that actually helps a person feel better. So if we think about when we're working with someone, what is probably the biggest overall takeaway that someone can have that really helps them day to day? Whether it's somebody with PD or really anything, anybody that we work with. What would you say the biggest takeaway that can really impact somebody's life day to day?
Maybe that they can actually be okay in the present moment.
Yeah, so being in the present moment and being with it, whatever it brings. Yeah.
Connecting as a community with a group,
Connection.
with a teacher, connection.
Yeah.
I think focusing on one part of the body helps me a great deal. Like, it's almost like when you're pregnant and you're giving birth, you concentrate on the breathing to help dull the pain.
Yes. So having a focus on one area. Yeah. That rather than it's like here and there, it's like actually my focus is completely here on this part. Yeah. So between what the three of you shared, Adam, Grizel, Fulvia, it's like it's a connection with the self, with myself, with others, and with something specific. The more specific I am, the more helpful it is. So if I can be specific, if I'm focusing on the breathing, if I'm focusing on something that's very, very specific in the body, it helps focus me, right? So our tendencies to want to have this that leads to this, that leads to this is actually the exact opposite of that, right? This is like I'm being very specific, I'm being very narrow. And if I, as the person in the class or in the one-on-one or the instructor, is mindful of the fact that, you know what, if I can observe what I'm doing and notice how it impacts me right then and there, that's huge. We go through life and we're not exactly super mindful, right? We wish we were, but we do things and then our minds are somewhere else and then we lose balance here and then it's frustrating. If I can be really focused on something in the present moment where I can then keep my focus on it, that's one of the biggest takeaways that's really, really helpful. And that's that development then when we're talking about yoga, it's that development of what can be referred to as witness consciousness, right? Where I'm aware of what I'm doing. So keeping that focus in mind in particular, let's look at a couple of things here before we take our break. So let's, for those who have taken mental health training with me before, let's talk about this a little bit. that what is it that we keep in mind when we're working with yoga for mental health in general? What is helpful for us to keep in mind, to review that part first? What would you say?
Grounding, it's the big part. Grounding.
Yeah. So the grounding, present moment. What else?
Check in with a client, see where they are.
Yeah. So frequent check-ins that are brief check-ins, right? Yeah. What else?
I mean, mental health and yoga, it's the breath.
Breath, yeah. So breath is key, right? Breath is prana, breath is life. Yeah.
You want to be aware of the language that you use
Mm-hmm.
with the client because it could trigger something for them.
Yeah. So being mindful of language, and again, being mindful especially of the present moment. Yeah. So one of the things that I think is interesting for those of us who teach yoga and do yoga therapy, etc., is that offering yoga is also an offering for ourselves, right? Because we all are programmed to be very goal oriented. And even when we sometimes introduce something like breath, then we think of breath as like, oh, well, that's something. And then over time, then we'll do more movement. But movement is not more powerful than breath, right? And that's why actually in the example, Fulvia, that you gave about giving birth, it's like when we're birthing, the focus is on breath. That's how important breath is. And so practices that have to do with breathing, with smaller movements like mudras, are especially helpful in many ways when we're working with PD, both for mental health and for physical health, if we pretend that those are separate, but for health in general. The smaller movements actually help folks be in the present moment more. And actually, in terms of even the physical symptoms, help with the fine motor skills, and that's very helpful. So I don't need for it to be fancy and have different things going on and adding and building. I actually need for it to be focused. And as challenging as that may be to focus, that also tells us even more how important it is. Questions, thoughts here?
Oh, I just want to, because I'm about to leave. What are your thoughts about using visualization with mental health and PD, like for them to visualize like their body in places that they're not longer able to be, but that they were there before?
I'm not so, and I think some of you who've worked with me know this. I'm not a big fan of visualizations because visualizations, again, take us out of the moment.
Mm-hmm.
And visualizations are about story, right? And there's that distinction between moment and story. So I can imagine myself, if I have a visualization of something that I'll never do, but I think is really exciting, that's one thing. So I don't know, if I am somebody who loves the idea of outer space and I visualize being in outer space and I know I won't go, that's fine. But most of the time, visualizations have a yearning quality to them. They have attachment to them.
Mm-hmm.
And attachment is the opposite of being in the moment.
Okay.
So I may guide a visualization where people visualize a quality. So I may visualize peace, I may visualize light. Those are qualities that maybe I want to embody. And then those are helpful for me. But yeah, visualizing a story or a place, something where there's attachment, I feel that that's a very different kind of exercise. Anything else here? All right, let's go ahead and take our break. So I have 22 minutes after, so until 32 minutes after.
I'd like to say a word real quickly to
Sure.
everybody. If you would please look in your chat at the bottom of the page And I've sent you a link so that you can sign in. Please sign in. You must sign in. So if you would just take a moment during the break to sign in. Thank you.
Thank you. Thank you, Melinda. Now I don't have to remember to ask people when we come back. So I appreciate that. All right. So it's probably, oh no, it's still 22 after. Okay. All right. I'll see you 32 after. How's everyone doing? All right. Okay. Okay. So we talked about grounding, right? And then these 3 areas of pranayama, so breath work, and then mudras, which are often hand movements, but not only, but what distinguishes them kind of in physical form is that they often relate to more fine motor skills. And then they also have impact within yoga philosophy that's very broad and deep. And then asana, i.e. physical movement. So let's talk a little bit about pranayama, about breath work. And breath work, when working with PD, is especially helpful as a lead up to any kind of physical movement. So some of the motor symptoms of PD have to do with rigidity. They have to do with involuntary muscle contractions. And if my muscles are tight and rigid, and I come to try to stretch them, that's not actually necessarily more effective, right? And we know this regardless of whether we have a PD diagnosis or not, right? So for those of you who may have worked with folks in yoga classes, general population yoga classes, where there is this emphasis on, okay, I'm gonna come and I'm gonna assist and I'm gonna push so that you stretch more. If the person tenses up, not good news, right? So anytime our muscles are rigid, it's not necessarily like we can just make them stretch. Rather, what can really help us with gaining flexibility, which is one of the things that is directly impacted by PD, is breathing. So breathing then helps calm muscles down. And now if we engage with breath work, then muscles can relax a little bit, and now we can work a little more with flexibility. And in general, breathing releases tension, lowers stress hormones. Temperature regulation is also an important thing, and that's one of the things to also keep in mind as we do breath work, is how it affects temperature. So when we're looking at, again, emotional health as overall, and when we're approaching the body in a way that's holistic, where we're not separating out emotional health and physical health, then actually what's helpful for physical health is helpful for emotional health and vice versa. In other words, if emotionally I am gripping and I'm super tight and tense, and you come to me and you say, relax, I'm never gonna relax, right? Whereas if you help me breathe more slowly, then now emotionally that impacts me and I can also relax. So the physical and the emotional work together. So working with breath work then helps gain that flexibility in so many ways in the body and the emotions as part of the body. So I'm going to share with you a video that's not related to yoga, but anything we can make related to yoga the minute that we bring in that piece of witness consciousness, that piece of awareness, right? That's what makes it yoga, is that I am noting how I feel in this present moment. So we're going to watch these 7 helpful hand exercises for Parkinson's that would help with handwriting flexibility, dexterity. But what we're actually watching out for is how we may be able to shift them so that when we incorporate them in a yoga practice, they can then help in so many areas beyond just these areas which are already helpful, and including focus on emotional health. So as you watch these, thinking about what's especially for folks who teach yoga and then for everybody, what are a couple of ways that you might take one of these hand exercises and introduce it in a class in a way that allows it to be more yogic, i.e. more mindful, but then also maybe incorporating something that maybe a mudra you're familiar with or a breath, for example, that you're familiar with, and then we'll share about this a little bit more. Any questions about what I'm requesting? Okay. So let's start here. Stop the share here.
All right, let's work on those wrists a little bit more. So you're gonna bring your hands out nice and straight, away from you. Get really reach those wrists up, hands, fingers extended, everything up, 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 up. And then you're gonna pull them all the way down. So my elbows stay straight during this whole thing. Nice and straight out, and you're gonna bring them back up. So that's 1, 2, really pull, good, all the way up, 3, 4, 5, 6, good, 7, and 8, 9, feel the burn, 10, 11, 12, 13, my hands are tired, 14, 15, 16, 17, almost there, 18, 19, 20, whoo, very good. My 20 was kind of lame. I'll do another one there. Oh, 20, very good. Nice job, you guys. All right, moving on to our next one. We're feeling powerful, feeling good. So let's go ahead and bring those arms out. Palms are gonna be facing up. What I want you to do is really reach them up and just try and get them away from each other. And then you're gonna flip your hands so that they face away from each other. So you're really working on that twisting motion of your arms. So we're gonna call this 2 and 3. Very good. 4, 5, 6, 7, 8. Keep those fingers extended. 9, 10. Keep an eye on those hands. 11, 12, 13, 14, 15, 16, 17, 18, almost there, 19, 20, very good. Now get a little shoulder work in there as well, which is great. All right, next one. You're gonna take your hands, and what I want you to think about is trying to touch the pad of your finger to this lower portion of your finger. So you're really just gonna curl your fingers in, so it kind of looks like this. So here's from the front, if they're facing each other. Notice my thumb is also getting involved, so really trying to bend here. So you're not making a fist, you're really just bending at the fingers themselves. So we're gonna extend in between each one. So when you bend, you're gonna extend up, nice and powerful, really big. We're gonna call that 2. 3, extend, bend. 4, 5, don't forget about the thumb. 6, 7, 8, 9, 10, very good. 11, keep extending. 12, 13, 14, 15, 16, 17, 18, 19, 20. Good. Make sure you're really getting that big, good extension in between all of these exercises. Really good to try and help get those fingers nice and warm. All right, next one. This one's a little bit easier, so you can take a sigh of relief just a little bit. So what you're gonna do, I call this one tabletop. Your thumb gets to take a little break on this one, so it's just kind of hanging out to the side. And you're just gonna take your fingers, keep them nice and straight, and try and make it a nice tabletop right through here. Good, nice and straight. Mine struggle with this a little bit. All you're gonna do, you're gonna bend and extend. So again, big, wide fingers. You're gonna bend, this is number 2, extend. Bend, good. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, almost there, 17, Extend 18, 19, 20. Very good, you guys. We're almost there. We're making good progress. All right, last one of these exercises, I promise. So 20 more. What we're gonna do with this one, so think about the very tip of your finger here, trying to reach down as low on your palm as you can. So again, we're not making a fist here. What we're gonna do is you're gonna bend your fingers down. You're really trying to reach these guys so they can reach as low down on your palm as you can. So again, your thumb kind of gets to take a break during this one, which is kind of great. So you're gonna bend those fingers down, touch the bottom of your palm, and then extend up nice and powerful. So we'll call that 1, reaching down, 2, 3, 4, keep it up, 5, 6, 7, feel the burn, 8, 9, 10, 11, extend, 12, 13, 14, 15, 16, 17, 18, 19, and 20. We made it. Very good, you guys. It looks great. I encourage you guys to try this for 2 weeks, just one time a day for the next 2 weeks. You could even try things like writing your signature right now, right this second before you start the exercise, and then testing it out again 2 weeks from now after doing this consistently. A good time is kind of right before breakfast, so you can kind of get your hands warmed up for the day. As you've noticed, your hands might be a little tired. Mine are definitely feeling burn, and that is totally normal. If you would like some more resources, you can head on over to Invigorate PT. All right. Gotta end this and go back to all of us here. Okay. So first of all, in terms of, if you will, yogifying the practice, what element of it is not particularly yogic? In other words, what might we do differently overall?
It's the pace.
Yeah,
It might be a little too quick.
So this and this and this, yeah. So it's quick, yeah. And that quick pace, what does that do in terms of being in the moment?
Speeds up the breath.
Mm-hmm. Yeah. And speeding up the breath in general does what?
It creates anxiety.
Yeah, not calming, right? So it's like, I don't want breaths that are super slow because then there's enough room there also for anxiety to come up. But yeah, I'm like, and 1 and 2 and 3, there's like it emulates breathlessness even if we're not breathless. So yeah, it connects in our mind with something that potentially raises anxiety. How is the person leading the movements in terms of how she interprets whether we want to be there as the people following? Does she think we want to be there, or does she think we want to get it over with? Yeah, so she thinks we want to get it over with. And that's very different. And that's, something that I think is a very clear demarcation in what we do, that this is about being in this moment. However uncomfortable the moment is, it's about meeting the moment, right? So if we're to think about then some of the variations that we might carry out that would be helpful in terms coming to this from kind of the lens of a mudra, even if we're not necessarily following a particular mudra, while also incorporating maybe pranayama or something else. What are some examples that you thought of as you were watching?
I thought of I personally do some of these exercises because of my weak wrists. Also because I play instruments, and sometimes I tend to like have a lot of aches at times. So a lot of the hand ones, actually, I do them very slowly, which actually help me a lot. But when I do it slowly and gently, but I was also thinking that you can incorporate lion's breath with it. Just the sticking the tongue is very fun. Because when she was doing this one, when you open up your fingers, lion's breath came to mind. Yeah. And doing that, I think it just incorporates like the fun side of it. Yeah.
Absolutely. Yeah, thank you. Other thoughts?
I usually do the internal and external rotations. So mental health, you want to focus on grounding asanas, and warriors tend to be very grounding. So you just add, like, for example, in warrior two, you can add breath work too. You can inhale, externally rotate, and then exhale, internal, exhale. And it's a good way to incorporate in, and it's still grounding, and you add breath work.
Absolutely, absolutely. So incorporating the movements within asana. Yeah. Other thoughts?
Opening the fingers and closing with the breath, or the satanama of just kind of following, the breath with that.
Yeah. So Grizel, since I know that you've led this a few times before, could you lead us in one of those? Whichever you prefer.
All right, so we're gonna open and close the fingers, just kind of gently bringing the fingers to meet the thumb, and we can keep the hands on top of the legs. I'm just gonna have them up here so you can see. So focusing on the breath as we inhale and gently open the hands. And then as we exhale, bringing the fingers together. So the hands don't have to open completely, just open to a relaxed position. And then exhale and bringing them together.
Thank you. Yeah. Anyone else up for leading us in something? And this is a chance to practice. All right, Tiffany.
I was gonna also introduce I guess I could lead it. So there's some hand exercises from the arthritis book from Dr. Lauren Fishman that I love to use as warm-ups in my classes, and they pace with the breath really well. So one of my favorite is hands together, because that's something that you could start a class after Namaste to start the breath. And then you just inhale, reaching up through the arms, through the shoulders. You can also interlace the fingers and do a point at the top, reaching through the shoulders, which is a good stretch for Parkinson's with the shoulders. And then you exhale down with the hands together, but you go slightly past center till you feel a stretch in the wrists. And I usually do that for about 5 breaths, pacing at your own breath. Inhale, reach, extend through the spine, through the top of the head. Exhale slightly past center till you feel a stretch in the base of the wrist. Inhale, you can close your eyes or look at a drishti in front of you. And exhale. And just do one more. Reaching, extending, and exhale to the stretch. And then usually I meet at the center right above the diaphragm and synchronize the breath, rotating the wrists up and down as a continued practice.
Great, thank you. So if we were to focus on grounding with that, bringing in then the focus on the mental health symptoms, right, in addition to the other pieces, what might we emphasize then as we go through the movement? What might help somebody be more grounded in the present moment?
Your external surroundings. Oh, sorry.
Yeah. So one of you used words and one of you used a gesture. Yes. So your external surroundings. So focusing outward, right? So what's the most obvious thing that I can look at is my hands when they're here, right? So watching the hands and then inhaling, bringing them up, and I can watch as far up as works for me. Exhaling, coming back down. Yeah. So that's one sense. What's another sense that really helps with grounding?
Just the connection, really, right?
Touch,
Having the contact, points of contact.
Yeah. And then again, that's helpful motor symptoms wise too, right? So if I bring my fingers as far apart as I can and I press as much as I can, the fingers against each other while relaxing the shoulders as much as I can as I inhale up, exhale down. And I'm actually going to ask you to try to do that, or because I'm going to ask you to notice how that impacts your movement. So if you press your hands together so that the fingers press together as much as you can get them to press, and then inhale up,
And notice where that takes you as opposed to if you don't press. And then exhale back down. So with them still pressed. So staying with the press for now, like really pressing the hands into each other. And then I'm going to ask you to release and kind of shake things out in whatever way works for you. So it's like, okay, that was a movement and experience and putting it aside. And now let's go with the first version that we were doing that Tiffany led. So the hands are together, but we're not directing any particular words in that direction. And I bring them up and back down. What did you notice between the two options? Whatever it is that was the reality for you, not looking for anything in particular.
I didn't feel as grounded.
Which time?
The second time.
The second time.
Right, the other version. It felt after we pressed palms, and then we didn't press palms, I felt a little loosey-goosey.
Yeah. Right? So when we did it the first time, we noticed the palms, but then when we pressed even more, we really noticed it, so that when we went back, then yeah, there's really that contrast. So noticing how just something like pressing like that makes a difference in terms of how for you, Melissa, you felt in the experience. How about other folks?
I felt like it went much faster. I think just the act of pressing really firmly, you notice the sensation of it a lot more and it slows you down.
Yeah. So the pressing, then you notice the sensation more, and then the movement is slower. And when the movement is slower, hopefully what else is slower?
Your breathing.
The breath. Yeah. Yeah.
That's what I was going to say. I felt like I breathed a little deeper because my chest was engaged from the pressure.
Interesting. Yeah. So felt a deeper breath. Yeah. Anyone else?
I felt that my body was more engaged. I don't know if because I'm sitting in the couch and I'm a little caved in. I'm not sitting really straight. But when I was pressing in, I just felt like my entire upper body just very connected and just engaged. And that helped me be more present and more grounded.
Okay. So you felt more of that engagement. Okay. Good. And then how about for you all, how far up the hands went each of the times?
It went less high when I was pressing.
Right? That the pressing, actually, it's slower, but going up is also kind of a stream versus the up and down like this. Yeah. And so that's a reminder for us that bigger range does not necessarily equal more engagement, right? Which is something that we have to remind ourselves of often when I mention that the smaller movements are actually what bring the greater gains for the system overall, emotionally and physically, overall the system. That yeah, the bigger movement, it's like we're all like pretty much off the screen, off our little square, but we don't feel so present as when we pressed more and we felt more present in that smaller amount of time. Thank you. Any other hand movements that anybody wants to share here?
I don't know what it's called, but I love the one where you touch each of the fingers individually. I use that a lot with a lot of my clients. Not necessarily because, I work mostly with people in addiction. And every once in a while, we'll get clients who are very limited in a lot of the activities that they can do. So a lot of the, kind of general movement classes that we try to organize with people, it's not necessarily accessible to them, but I always want to create things that are accessible and have everybody participate in them. And I found that exercise actually, I think, is more beneficial even for the people who might be able to do these bigger movements, because they are like less showing off. Oh, I'm doing this, I'm doing this. They're so much more specific and focused in what they're doing. And when you do one full breath and you have them count the breath, with each of the movements. So I'll try to coach some sort of a breathing exercise, very simple pranayama in the beginning, maybe an even breath in and out. And so we'll work with that. We'll practice it. Maybe we'll feel it in the belly then. And then we'll bring the mudra in and do each one of your fingers. Then it becomes this huge, long practice that you're doing where you're sitting for a very long time doing something very specific, very mindful. And you can feel how it shifts the mood of the room dramatically.
Mhm. Yeah, absolutely. And this, yeah, what traditionally is done like sa, ta, na, ma, and it kind of depends on the tradition that you're trained in too. But yeah, that connection and these smaller movements is also very centering if they're done intentionally, right? And similar to, the example that Grizel you gave as well, that yeah, it's like going through each of them, and I can do da, 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 da. But if I really bring that contact of the thumb and the finger, I experience that so much more. And we talked, go ahead.
Oh, I was just gonna say, I do that one often, but I'll give like a mantra, like people could use, but the same way, like doing a breath into it and then doing that and then letting them say something that's like meaningful. And I'll offer up like a few options, but anything with a few words that hits them.
Yes. It's like you and I were going in exactly the same direction. Yes. That it's like if we do this, for example, so sa, ta, na, ma is what's traditionally done, but if there are words that resonate with the person, then they potentially are the more meaningful when we're talking about grounding, etc. So if there's something that resonates with the person, then it resonates. Sometimes I'll offer like, I am here now. Right? So it's like, again, it's present moment. So I'm not like somewhere else, I'm still here. But yeah, so noticing that if we do that now and really taking the time to touch the thumb to whichever finger and noticing the breath and how that feels. And I'll just, invite you to go at your own pace rather than leading it, just to notice at your own pace what happens. So as you touch. So I'm turning my hand so that people who may be unfamiliar with this are seeing what's happening, but ideally you want to have the palms towards you. Notice how slowing it down impacts you, and especially if you repeat something to yourself and really feel that connection between thumb and finger. Do one more round at your own pace. And then once you've gone through the round, taking a breath in and a breath out. All right. So, any questions here first? So now we'll watch a portion of another video, and this one actually is a yoga for PD video. We're just going to watch 3 minutes or so. And I'm going to ask you this time as you're watching to think about how you would more directly think about emotional health if you were leading some of these practices, what you might incorporate. And then we'll talk about it a little bit more.
For me, meditation is the key to make a claw, relax again, relax again. Make a fist rotate. Reverse. Inhale and then open your fist. Again. Very good. Bring both hands on your shoulders, forward and back. Sideways. Relax. Make a circle with your shoulders, bringing them up, forward, down and back. Big movement, big circle. Reverse. Relax. Bring both hands on your shoulders, elbows in the front. Big circle again. Very big. Reverse. And relax. Neck movements, isometric neck exercise, holding your hands together, pushing behind your head. Forward. On my right. On the chin. Again. And relax. Acupressure points.
All right. So your thoughts about some things that you could incorporate variations of, but again, being mindful of that emotional health piece and foregrounding that or emphasizing that as well. What comes to mind?
I loved the pressing.
Mm-hmm.
Of that sort of like, just it brings awareness of like, this is my body right here. This is this place where I can touch in, gives that like proprioception. I love the tapping exercises. I feel like tapping is really nice for the nervous system. And, you know, I feel like it's very, in general, it's very accessible. And doesn't have such a huge movement to it because it can be very subtle. So like the tapping can be very soft, but you know, and you can take your time with it because you can spend time in a lot of different places tapping. I like those types of things.
Yeah. And those things too, people can do on their own time, right? Which is a very helpful piece to offer always, right? Is it's like, yeah, there's what happens in class, but there's also what someone does on their own time. And so having something that someone can do on their own time is especially helpful. Yeah. Other thoughts?
I think slowing it down a little bit and adding breath to each movement would be great.
Yeah. Yeah. So there's, I mean, this, for example, well, versions of this, the fast, I mean, in addition, also one other piece that I'll throw in here is as you watch me do this over Zoom, which is a little bit different from if you were seeing me in person, how do you feel when you see me do this over Zoom? Right? Yeah, this, absolutely. And so also just that piece, in addition to everything, that as we do things over Zoom and, you know, that additional element, that it's like slower and being more mindful actually is especially relevant to keep in mind in the session, and then also for the overall
with working with mental health. So yeah, like inhale, exhale, and then maybe I try to switch it. Inhale here, exhale here. Notice your hands as you bring the arms forward, right? So I'm moving slowly and deliberately, and I have a focus point. The more you can engage the senses, right, that's key to emotional health and being in the moment. So looking at something, if that's available to somebody, pressing into something, if that's available for someone, and then saying things out loud, if that's available. Other thoughts here?
I didn't realize how good applying pressure just feels.
Yeah.
Just around your head. Feels nice.
Yeah, so having, like the first one that he began with the arms here, and then, this in here. Yeah, and one of the things too, in general, that's especially helpful if we're working with rigidity is, and again, so rigidity, if we think of it this way, rigidity and anxiety are very closely intertwined, right? So one we tend to think of as physical and one we tend to think of as emotional, but both of them have something where the system is like, on alert. Yeah. And so movements that are less familiar can really help with that. So if I experience rigidity in some shape or other to my system, then that gentler press that's more unfamiliar can be very grounding and can be very helpful training for the system. Yeah. All right. So I'm going to talk a little bit about a few other pieces that have to, that are relevant, let's put it this way, especially relevant when working with PD, and then we'll bring some of all of these together as well. So sleep can be a major element when we're talking about PD. So sleep-related problems for folks can be classified into what we call daytime manifestations, nocturnal sleep disturbance, and then sleep-related movement disorders and parasomnias. Anyone familiar with parasomnias, what that means? Okay. So parasomnias is basically like under sleep. So it's a little bit like that term paraprofessional, or even like a parasol, like you're under the thing protecting you from the sun, you're under the sun. And so it's basically that you're under sleep. So you're not like fully asleep. So things, for example, which are not necessarily the one that's relevant to PD, but the one with which people are familiar the most is sleepwalking. So it's like you're not fully asleep, you're somewhere there, but you're still moving around. So it's like the brain hasn't let you completely rest. And that's something that happens in PD. So not with sleepwalking, but in general parasomnia.
Is sleep paralysis along with that, or?
Yes. So sleep paralysis is also a parasomnia. Yeah. So daytime sleep manifestations include excessive daytime sleepiness. So it's not uncommon with PD for people to feel like at night they don't sleep very much, but during the day they're very sleepy. So it's like the sleep schedule is off, sort of the clock, the internal clock is affected. So the nocturnal sleep disturbances include insomnia and can include sleep apnea. And then again, one sleep-related movement disorder, it's also connected to parasomnia, is restless leg syndrome, right? So something shakes. So in general, we're talking about sleep that's not restful. So highlighting that to kind of file it away as something to work with, that when we're talking about sleep, we're not necessarily, if you're a yoga therapist, we're not necessarily helping people sleep. Like it's a little bit different from if someone comes to you with insomnia. Rather, what we're actually helping somebody with is allowing the body to relax more. So ways that the body can relax more so that when it's time to sleep, sleep can be a little more relaxing. The body can release a little more. So what's referred to medically as like cognitive deficit, so it basically means that the brain is somehow impacted so that it doesn't function in the way it may have previously functioned. So sometimes people develop dementia. Sometimes people develop what's referred to as mild cognitive impairment. So basically the difference being mild cognitive impairment is that somehow my brain doesn't work the way it used to, but it's more impacted in terms of quantity of information it can hold. So for example, memory might be affected, that I notice I don't remember what I used to remember. That's different. So the example that often is given between the difference between if we move away from PD completely and just talk about cognitive decline that happens with age, the difference that's often made between, okay, age-related cognitive decline versus dementia is that I may not remember where I put my keys. And as I've noticed that I don't remember the way I used to remember when I was younger, that might be age-related cognitive decline. Whereas if I don't remember what keys are for, then that may be an example of dementia. Okay, so it's two very different things. And I think it's important to know that whether for oneself, for someone in one's life, or for people you're working with, that a lot of the time people think that, oh, I don't remember this, I must be developing dementia. And it's like, no, like I keep putting things places and forgetting where they are. That's not what dementia is. Can that potentially down the road someone develop dementia? Sure. But in general, dementia is about function and knowing what is done for what. Okay. So many PD patients, if untreated, if they are not active in certain ways, are more likely to develop dementia down the road. And that's why cognitive engagement is really important in work with PD. So this we talked about. And then I just wanted to mention a couple of things, and you can all look into them on your own time if it turns out to be something that's especially relevant to you. Again, whether for someone in your immediate life or for people that you're leading in a class, etc. Is there are a couple of different types of dementia that can develop in PD. So the relevance, the most important takeaway to just keep in mind is that one kind, if someone has it, is more likely to develop earlier, and that's the dementia with Lewy bodies, the DLB. That develops earlier in the course of a disease. So the reason I mention it is for those of you who are yoga therapists, if you are working with someone and it seems in general like, you know, they were diagnosed recently, their motor symptoms aren't impacted that much, etc., but you think you may be seeing dementia, that that's not necessarily impossible, that it might be this kind of dementia. Okay. Versus a different kind that might develop later in the disease. So just knowing that there are these two different kinds of dementia that may develop with PD, and that using cognitive cues is also really helpful in training the mind and facilitating later onset, at least. I'll leave this for folks to look at in your own time if it turns out to be something that is especially relevant for you.
Is there a way you can give an example of like how dementia might show up in terms of a reaction to a cue and what would be helpful?
Yeah, so actually I'll talk about that now in talking about working with dementia. Yeah. So ultimately, if someone is experiencing dementia, what dementia is changes in thinking and changes in reasoning. So if I am experiencing dementia, I might have a hard time. For example, if I am in a class with you, I might have a hard time getting from where I am right now, sitting here, to what you're showing me and asking me to do. That's one. And there are a few reasons for that. We'll talk about mirror neurons kind of towards the end of our last hour here today. That's a little bit part of it, is that in general, we have mirror neurons. So I see you do something, and that's reflected neurologically for me. And that's why a lot of the time, if we see someone smile, we smile back without thinking about it. But if they're impacted, then I see you do it, and I have a harder time figuring out what to do in order to do that. So I see you raise an arm, and I have a harder time than figuring out, okay, I need to raise this arm here. And so, of course, what if I'm experiencing that, what's the main emotion most likely that you're going to notice in me in the class environment? Frustration, right? So noticing that if you are encountering someone who's agitated and frustrated, then maybe there's something going on cognitively. And then the other thing too is when we're frustrated, regardless of the reason for the frustration, right? Not necessarily connected to health, but if I'm frustrated, who is the easiest person for me to take it out on? The person who's directly in front of me, right? So knowing that if someone is agitated and maybe is frustrated at you, then maybe that's a clue that actually there's something that you're requesting that is hard for the person to do. So changes in thinking, one of the ways that people around someone experiencing dementia notice, people who know the person well, is that there's a very clear shift in kind of the thought patterns of the person. So for those of you who are here because you'll be teaching a class, that may not be apparent to you from the start, right? But then if there has been someone that you've known for a long time and you see a shift, then that can be an indication, right? So there's a marked change and a shift that happens. But keeping in mind that if you're encountering agitation, it's like, why is it agitating for the person? And remember, agitation can show up as I'm worked up and agitated, or it can show up as I'm disengaged and checked out. Disengaged doesn't mean that I'm disinterested. It could mean that I'm frustrated. I don't know how to follow. I'm having a hard time following. Another piece is that there can be a cycle of confusion and alertness that can vary significantly. So you might encounter and interact with somebody who is feeling more confusion at some times and alertness other times, and that can still be part of it. Generally, when we're talking about PD, for people who have experienced cognitive symptoms, if that's how it shows up, there can be memory loss, but it's not like in Alzheimer's. So the person's day-to-day life may be impacted less. And then where the proteins are that lead to this can make a difference, but we're not doing brain scans here, so it doesn't really matter. What's important to us is how this impacts how we're working with the person. So this we touched on a little bit, and I'll leave for you to look at outside of this, if that's something that feels relevant for you. So I'm going to ask you to take a few moments here to think of different movements for particular groupings here. So knowing that someone who is coming in with PD, it's important to address mental health. It's important to address physical stiffness, which again can be related to emotional rigidity, right? Anxiety. Maybe cognitive challenges, and maybe sleep. I'm going to ask you to take kind of 3 or 4 minutes here. For those of you who are yoga therapists, yoga teachers, to kind of jot down what are some practices that you may lead this person in, and keeping in mind that we'll be doing some of these together. So being ready to lead us as a group in one of the practices, not the whole thing, but just one. And then for those who are here, either for a personal experience, either yourself or someone else in your life, just thinking about what is helpful for you in thinking what kinds of movements, what kinds of breath might be helpful for you that helps with mental health or stiffness or anything, sleep, etc. Anything that you've noticed helps you. And then so taking, let's say 5 minutes for us to either think or jot down for those who'll be teaching classes, and then we'll connect again. Questions here? All right, so go ahead.
So I just put in the chat here what it is that I'm requesting you think about since the slide has disappeared. All right, so 30 more seconds or so. Okay. So what's one practice that somebody would like to lead us in that would be helpful for those pieces?
And the pieces were cognitive stiffness and sleep. Is that right?
Yeah, in addition to emotional health. Yeah.
Okay. Um, I'll lead with one.
Thank you, Melissa.
Right? Okay. So let's just find a comfortable seated position and just check in that both of your hips are kind of even on the seat or the ground beneath you. Soften your gaze. You can bring your awareness to something in the room. You can soften your eyes or close your eyes. And just let your inhales grow, let your exhales grow a little bit more than usual, but still at a pace that's comfortable for you. Bring your awareness to your heart center or your chest space. Imagine breathing in and out through the heart space. A little bit more fully than you were before. And now let's imagine an uplifting feeling, such as joy, compassion, love, appreciation. Imagine breathing this uplifting feeling in and out through the heart space. So start to notice the temperature in the room, the sounds in the room. As we start coming back, you can start wiggling your toes or fingers around or take some organic movements. As you open your eyes, notice one thing in the room that might be neutral. Notice the taste in your mouth. Thank you. Namaste.
Namaste. Thank you, Melissa.
Thank
Who's
you,
next?
Ghada.
I can go.
All right.
So we're gonna do a pranayama today called Nadi Shodhana. And usually when we do Nadi Shodhana, this pranayama, it's an alternate nostril breathing practice. Sometimes we plug the nose so we can be very focused in breathing in through one nostril and then switching and doing the other. But we're gonna let all of that go today. That's not important today. Today, I'd like you to just first come to find a comfortable seat. Make sure that your feet are fully connected with the floor and that your hands can rest comfortably on your legs. They might press gently into your legs. And you can find a seat where you can sit up nice and tall. And then I want you to think for a moment about a color. And you can choose any color. It can be your favorite color in this moment right now. And we're going to use this color to help visualize our breath. So I'll give you a moment to choose your color. And then we're going to practice together first, just breathing this color in and out of the body. We'll begin by first closing our eyes, and you don't have to breathe in any particular way, but just I want you to see that color in your mind's eye as you breathe the color into your body. Watch the breath flow in, and then watch the breath flow out. Notice the color as you breathe in, expanding into your body, into your heart space. And then gently flowing back out through your body. We'll take 3 more breaths like this, softly breathing in and letting the breath go. Seeing the color flow in and the color flow out. Breathing in once more, letting your heart fill with this color. And then the color flows out through your body. We're going to add on to this practice now. If you'd like, you can close your eyes if they're not already closed. If it feels more comfortable to keep your eyes open while you do this visualization, that's fine. What I'd like you to do is think about seeing the color flow in just through your left nostril. Breathing the color in through your left, into your heart, and then watch the color flow back out through the right nostril. Watch the color flow in through the right, deep into your heart, and then gently flow out through the left. The breath flows in through the left, into the heart, flowing out through the right. In through the right, deep into the heart, flowing out through the left. Go ahead and let this breath continue in through the left, into the heart, out through the right, and then back in through the right, into the heart, and out through the left. A few more times on your own. And then finishing up whatever round of breath you're on, bringing your hands at heart center, pressing the palms, feeling that contact of your hands touching each other, your feet pressing against the floor. One more breath in, the color flows into your heart. And then gently release and let it go. Thank you.
Thank you, Adam. All right, so I'll go ahead and lead us through one. So if you're like me and you're sitting right at a desk or a table, then you want to go back a little bit so that if you lift your arms, you're not hitting into something.
And then bringing your hands onto your lap, if that's accessible to you or somewhere in front of you. And then we're going to inhale, bring one arm up, so it's directly in front. And then we're going to exhale, we're going to touch the thumb and the forefinger. We're going to inhale and release that. And exhale, bring the arm back. Same arm, inhale it up. Exhale, middle finger and thumb touch. Inhale, release. Exhale, back. And same arm, inhale. Exhale, now third finger and thumb touch. Inhale, release. Exhale, back. Last time on this arm, inhale. Exhale, pinky and thumb. Inhale and release. Exhale and back. Pause here for a moment. If you like, you can bring both arms down by your sides or any way that feels comfortable. They don't have to stay on your lap as you pause. And just notice how your right side feels and how your left side feels. You might notice a difference, you may not, just being aware. Switching to the other side. So inhale, other arm up, directly in front. Exhale, first finger and thumb touch. Inhale, release that. Exhale, arm back. And again, same arm, inhale. Exhale, middle finger and thumb touch. Inhale, release that. Exhale, back. Twice more at your own pace now. As you inhale, bring the arm up. And then exhale, allow the remaining two fingers to touch the thumb. So ring finger on one turn and come back, and then pinky on the next as you come back. Feel free to follow me or go at your own pace if you'd prefer to go more slowly, just making sure you don't go faster than what I'm guiding. Once you're all the way back with that second arm, again, noticing the two sides of the body. Breath in, breath out. And noticing one word that describes how your body feels right now. Whatever word first comes to mind. And from here, kind of releasing the seat that you have, shake things out in any way that's comfortable for you. All right. And coming back closer if you've moved far away. So yeah. We've had different variations, right, that combine those two things. Adam, did that just like get knocked over in the back? Okay. It's like we just never quite know what might happen, right? Yeah, so noticing the three variations that we were led in, or you were all led in, noticing where each of the pieces is. So for example, you know, with mine at the end, since I'm aware of my intentionality, right? So I'll share that example. Then for me, where is the emotional health component of that movement? What might I be keeping in mind, right? So what are your thoughts about that? What might I be keeping in mind with that movement?
It was unfamiliar movement, so it kept me present. It kept me guessing. It was a slow movement, one arm at a time, so that was very relaxing at the same time.
Okay. So yeah, unclear where I'm going, so you have to kind of follow. Yeah, so you have to be present. Yeah. And then at the same time, I don't want it to be too fast. What else might I be keeping in mind in terms of mental health, emotional health?
Meeting them where they are. So I felt like nothing was either too slow or too fast, just in case someone's in either more anxious or more like they could be down. So nothing too extreme in either direction so that someone could join in.
Yeah, so relatively contained, right? Yeah.
Yeah, I
What
think
else?
it was a super focused drishti. I mean, you didn't, I don't remember you said to move the hand up and clip, but it was very, very specific. So you had to really be present to every part. There were many parts, I guess, that you had to participate in and be present to. So prevents the mind, I guess, from wandering. It's simple, so yeah, it made it easy to focus. Yeah.
Yeah, so I need exactly, I need either a drishti, right, where I don't want my hand to be super enormous right at the camera, so I'll pull back again. A drishti either where I'm looking, or if I have this great proprioception and I can do it without looking, nonetheless, the touch is helping me then ground. But for most of us, we're going to be looking as we do that, especially at the beginning where you don't quite know where I'm going to go. Yeah. And then there are the other pieces, right? So if we're thinking about stiffness, then having some movement. If we're thinking about the cognitive pieces, then, there's a little bit that I have to track. And then that relaxation piece then is what helps with sleep, right? So the more the body can relax, the easier it is to stay asleep and to be in sleep rather than in parasomnia. But again, we can't tell bodies to relax, right? And so guiding something that hopefully would bring about a little bit of that relaxation. All right, so let's talk a little bit about medication and a little bit about mirror neurons, and then that will be it for us today. All right, Elizabeth, thank you for the heads up in the chat. And hi, Dawn, good to see you, or to see your picture at least. All right, So one of the things that I would like to emphasize, and then again, if you have the information here, so for those who will be leading classes, etc., this is all on Schoology, so you can look back on it if you find that, oh, this is actually relevant with somebody I work with, and you have the information there, but just to go over it quickly. So this is what I mentioned at the very beginning of this idea of the motion-emotion conundrum, that there is a class of medications for PD for motor symptoms that can have a psychological impact. And when that happens, usually the medication is switched, but sometimes the medication is not switched until it's very clear that this is happening. So someone has the beginnings of something and then realizes that, oh, this actually may be related to the medication, or the doctor realizes, et cetera. So just being aware of that. So psychosis and PD are not two things that go together, right? So if someone has PD, that person is also very much in reality. There's no connection to that. Anyone developing psychosis, which is basically a thought disorder where your mind is hearing things that other people don't hear, seeing things that other people don't see, has particular ways of thinking, delusions that we'll talk about in a second. Anyone developing that can happen regardless, right? But that's not particularly connected with Parkinson's. But what are these particular medications? And so just being aware of that, if that's something that impacts anybody that you work with, that you're connected to. So in those cases, when medication does that, then the person may experience hallucinations. So that's, you see something other people don't see. Like I said, you hear something other people don't hear. Can also be olfactory, so you smell things other people don't smell. Or the person can experience delusions. So delusions are basically convictions that something is true, even though there is evidence that it isn't. And they may be bizarre or non-bizarre. So bizarre means that I might think that I am sitting here in a room and there is actually a dog by my chair. And if I have a dog, then that's not a bizarre delusion. It's just that others might look and not see the dog. But if I look and instead I think that there is a being that most people would think is not a real being, then that's what's called a bizarre delusion, that it's something that's unlikely to happen. If you are connecting with somebody whose medications are leading to this, usually the delusion is of something in the family of persecution. So somebody's after me. So if you're hearing a lot from someone that someone is after them, then chances are
that this person may be experiencing delusions due to medication if this person is on specific PD medications. So again, rare, but I want to put it out there so that you're aware. You have this information. The class of medications that can do this are dopamine agonists, so they simulate dopamine. So when you simulate dopamine, if we think of dopamine as related to a pleasure principle, that things get more exciting, that's how you simulate. And then in effect, it's like you're over simulating by additional things coming into the person's awareness. And then again, here are some of the medications that may do that. What's referred to as the motion-emotion conundrum is that if someone is on medication for PD, experiences psychosis, and is put on an antipsychotic medication, that can affect the physical symptoms of PD, especially the motor symptoms. So that's what's referred to as the motion-emotion conundrum, that are we targeting motor symptoms, or are we targeting emotional symptoms because we lose one or the other? There are some medication options that are available for this. If you encounter this, then this is a time for the person to go back to the doctor and do a medical reevaluation, but just to know of that possibility. Can also affect impulse control. So impulse control has to do with the fact that I see something and I go for it right away. So again, if you know a person who generally does have impulse control issues, and suddenly they see this thing and they go for it right away, then that might be an indication. So impulse control can include gambling, sex, impulse shopping, binge eating. So we're talking about someone who did not engage in these behaviors and then suddenly finds themselves engaging in these behaviors while on some of these medications for PD. That could be an indication that this is a result of the medication. All this to say that for those of you who are yoga therapists and working with folks with PD, having medication information is helpful. Then if something shows up, then you know, okay, maybe it's related to this, and then you can advise the person to talk to the doctor. Here's some information that you'll have, and you can refer back to it, like I said, if it turns out it's something that comes up. And then finally, let's talk a little bit about your emotional health as the therapist, or as the caregiver, or as the patient. So I mentioned very briefly mirror neurons, and mirror neurons are basically something that we all have, where, like I said in the example, if I see you smile, I naturally smile back. That's my mirror neuron. So I'm mirroring you. And that's something that's adaptive. So it helps build connection between us. However, the tough thing about mirror neurons is that mirror neurons build connections sometimes at times when there's difficulty. So if I am working with somebody who's experiencing difficulty in either role, so for me as a psychotherapist, for example, working with my client might be having a really bad day, and my mirror neurons then reflect that, and so then I find myself down. Or alternately, what I'm watching out for is especially this in a therapist. If I, as the therapist, I'm not quite grounded, and let's say my client comes in and I'm like, oh, what am I going to do? How can I help them? And I'm a little bit scattered. They can also pick up on that energy, and therefore they now may potentially feel a little more scattered, agitated. So this is why then, even as the therapist, the caregiver, as well as the person who has the PD diagnosis, grounding and stabilizing for all of us is so important. So for those of you who are teaching classes, then thinking about as well for you before going into the space, what is it that you do that helps ground you? For someone who's a caregiver, what is it that you do that helps ground you? If you are a caregiver, or for all of you who may be working with a caregiver,
helping the caregiver have a practice that they may turn to that's very, very quick that helps recenter them. And we'll end with that. So in a few moments. But just keeping that in mind, if that's something that resonates for you and there's something that comes to mind for you, then holding on to that. But then also we'll do some of that. So rather than mirroring anxiety symptoms and mirroring depression symptoms on either side, like I said, if I'm the teacher and I'm anxious, that also doesn't help the client who's there to not be anxious as a student, and vice versa. So how do we all help ourselves be in the present moment rather than get pulled in by what someone else is experiencing? So let's pause here for a moment, and I actually will, there we go. I actually will first take a moment and guide us through one centering, and then see if there are any questions, and then guide us through the second centering, the grounding. And I know, Melinda, that there are a couple of things that you want to say at the end and information to share. So some of you are familiar with this from having taken class with me. We're going to do it a little bit differently. So I'm going to ask you here to take a moment and again, press your feet into the floor. And then place your hands on your legs if that works for you. And then I'm going to ask you to inhale and just press your feet into the floor and press your hands into your legs any amount. Notice the contact between your hands and your legs and the contact between your legs and the floor. And then exhale with a sigh and release all of it. So body's like as relaxed as you can get it to be. And again, hands come onto your legs, press into your feet as much as you can. Inhale, so you're like really noticing. And now look at a point in front of you, wherever that might be. And exhaling and releasing. And now I'm going to ask you, and this is the part you're familiar with, to take a moment to look around the room and notice 5 things that you see, whatever they might be. And just calling them out, since all of us pretty much are muted here, then we won't be able to hear. So just calling out the 5 things, so lamp, table, chair, whatever it is, just calling out 5 things. And then noticing 4 things that you're touching or are touching you. And you can go ahead and touch things so that you bring them into that awareness of moving the hands around. And then noticing 3 things that you can hear. And you may notice 3 things you may not. And again, calling those out. Noticing 2 things that you smell, and you may smell 2 things you may not. And then bringing your hands together in front of your heart center and pressing your hands together. Inhale here. And then exhaling just one sigh and release. Any questions that anybody has here? All right, you know where to find me if you have questions. So I will give it to Melinda. Melinda, did you want to share the flyer or? Okay, so I'll let you do that. But I did want to close at the end with one more centering. So if we can stick around for that. Oh, you're on mute.
Got it. If you could make me co-host.
Indeed. All right.
Okay. So for some reason it's not coming up, but I'm going to send everybody a copy of our calendar of events. And basically, our classes will begin next week with Adam, and every week through June of next year. And we'll have a class on anxiety and depression and asana. Thank you. And also a class on meditation, classic meditations as taught by Yoganand. So our schedule is up, and you can visit our webpage. And if those that are leading classes for Parkinson's, they can share with you the dates. You'll be getting lots of information. So always check your emails. Both of the classes are offered in both English and Spanish, so there will always be one class. It alternates. And so in a month's time, there will be 2 classes of asana classes in English and 2 classes in Spanish, and 2 classes of meditation in English and 2 classes in Spanish. So basically 2 classes a week through June. So I hope that you'll all participate, and many thank yous to Grizel and Ghada for helping to create these beautiful protocols, and to Martha and to Adam. Yay, Adam, who knew that at the last minute we are going to say, you're on, kiddo. So I think it's going to be really great. Thank you all. In your chat, you'll see a link to an evaluation form. If you would please fill that out. You're not going to be able to do it later, so please fill that out. This is information that we share with the Parkinson's Foundation as part of our documentation effort. I also want to remind you, for those of you that are in this training, the next session is next Friday, the 23rd, Yoga Nidra, and Dawn, wave to the crowd. She'll be your teacher, and the focus is on sleep, Parkinson's and sleep. So please be there on time, come prepared to work. If you haven't had a chance to log on to Schoolology, please do so, because there's pre-course assignments that are due, and the due dates are the due dates. The due dates will not be extended. So Dawn's very busy, and she's fitting us in. So please adhere to the due dates. And I went ahead and texted you a reminder there in the chat, so you can note the date and time. But also please check your emails daily and respond to emails, please. So it's a lot to coordinate. Okay, so I'm going to turn it. Thank you all. I'm glad. I hope that you all enjoyed the program. So I'm going to turn it over to Ghada. Thank you, Ghada.
Thank you. So yeah, I'm just going to take a moment to close this out here, remembering that the eval is still there. So unless you've clicked on the link to open it, to not just leave the meeting and then lose track of the eval. So I'm just going to ask you to think about a container, like a box. And into the container, we're going to put everything that may have happened today, whether during our session or earlier today, that you don't need to really be thinking about as we prepare to transition to the rest of the evening. So that box can be as small or as big as you need it to be, and you're literally imagining that you're putting everything into that box that you don't need to be thinking about. It's like there are things in life, they're there, but we don't have to be thinking about them all the time. Putting them in the box. And taking your time to do this past my verbal guidance, if that's what fits for you. But when you're ready and have everything in the box, then making sure you're closing the box and moving the box out of the way. And as you prepare to move into the rest of your evening,
allowing the space in the rest of your evening to be only about what you need for the rest of your evening. Everything else that's in the box that you don't need will be there, but no need to go into it for the rest of the evening. And then as you inhale, bring the hands up. And as you exhale, bring them together, pressing the fingers into each other as much as works for you. Thank you so much for joining me today. Really appreciate your presence and your engagement. And please don't hesitate to contact me if you have questions. Namaste.
Namaste.